So right with the introduction of from the previous video, we're going to start with the enzymes that reflect the cholestasis: ALP, 5-nucleotidase, GGT, LAP, and glutathione E. So the first one we're going to look at is alkaline phosphatase because it's the most hardest one as in is the longest one. Alkaline phosphatase, the normal value is 30 to 120 international units per liter. The sources of ALP includes liver, bone, placenta, small intestine. What are they? Liver. So in GIT liye rendu liver and small intestine, and then bone, and then placenta. So like specifically during placental phosphatase, placental alkaline phosphatase is a very important term. Fine. The causes of elevation of ALP are given. The causes of reduced ALP is also given. Okay. So there could be physiological or pathological causes of elevation of ALP. Physiological causes include age more than 60 years, which is 1.5 times the normal. Okay. Age, adolescence, and pregnancy. Okay, so age on the more than 60 years, it becomes 1.5 times the normal. And then adolescence, because the bone, there is adolescent people who are undergoing rapid bone growth, and PS pregnancy in the last trimester due to influx of the placental ALP. And then okay, that's it. So the three physiological causes are age, adolescence, and pregnancy. Age naka old age, okay, more than 60 years. Moving on to the pathological causes: liver disease, primary metastatic tumor of the bone, Hodgkin's disease, Paget's disease, osteomalacia, sclerosing cholangitis. Liver disease is more rise occurs in obstructive jaundice. More rise occurs in obstructive jaundice. Primary or metastatic tumor of the bone. Okay, second one is bone tumor. Third is Hodgkin's disease, which is again a tumor, blood tumor. Okay, so first is liver disease, that is obstructive jaundice. Second is bone tumor. Third is blood tumor. Fourth is bone disease, which is Paget's disease. Fifth is another bone disease, osteomalacia. Sixth is sclerosing cholangitis. So in the bone itself, three things come. Okay, total on the six kuduthirukanga. In the bone itself, three things happen. Bone tumor, which is like primary or a metastatic bone tumor. Paget's disease, osteomalacia, and then one with the blood, which is Hodgkin's disease, the one with the gallbladder, one with the liver. So like with the gallbladder is sclerosing cholangitis, one with the liver is going to be obstructive jaundice. Okay, so these are all the causes of elevation of ALP. A point to be noted is that the ALP level is going to be normal in case of multiple myeloma. So like do not confuse, it's a Hodgkin's lymphoma which has a high ALP levels. Moving on to the causes which are going to reduce the ALP. So the first one is going to be magnesium deficiency, and then hypothyroidism, hemolytic anemia, Wilson disease, estrogen replacement therapy, congenital hypophosphatasia, blood transfusion causes transient decreases in ALP due to chelation of cations by citrate. Okay, so these are all the various causes of ALP. Okay, magnesium deficiency, hypophosphatasia, which is congenital, low thyroid level, high copper level, which is Wilson's disease, high level of bilirubin, which is hemolytic disease, hemolytic anemia, and high level of estrogen, which is estrogen replacement therapy. So much of blood, that is blood transfusion, causing a transient decrease in the ALP because of chelation by citrate. Okay, so that is all about the alkaline phosphatase. We saw when it is elevated, when it is reduced, the normal value is 30 to 120 units per liter international units. Okay, so moving on to 5-nucleotidase. In screening for liver metastasis, it has a high HPV, high predictive value. So like positive predictive value is going to be very high in case of 5-nucleotidase. Then GGT, gamma glutamyl transpeptidase. This is a potential marker of alcoholism. So like GGT is elevated in case of alcoholics. And then LAP. LAP stands for leucine aminopeptidase. This is useful in the diagnosis of biliary obstructive space occupying infiltrative disorder of the liver. So obstructive disorder, space occupying disorder, infiltrative disorder of the liver on the LAP. Okay, so LAP comes in between every single thing, like between every single thing. Okay, infiltrative, space occupying, obstructive. Moving on to glutathione E, transferase is used as a hepatic prognostic marker following surgery. Glutathione E apparently is a transferase. It's a prognostic marker following surgery. So avlodan, we are done. Okay, so ALP, 5N, GGT, LAP, GE, glutathione E. Okay, in multiple myeloma it's normal. ALP is normal.